Hello, I'm Dr. Robert Williams, Chairman of ECI. 2010 has been an historic and tumultuous year for American healthcare. On March 23, 2010, after a prolonged and highly partisan process, President Obama signed the Patient Protection and Affordable Care Act, known simply as ACA. Although the ACA will not be fully implemented for several years, this legislation will have a profound effect on our healthcare system, including emergency medicine and hospital services. What are the main components of healthcare reform? There's been significant health insurance reform, expanded coverage to more than 30 million people, a huge expansion of the Medicaid program, which is a joint federal and state program, an individual mandate, which means that everyone must have health insurance or pay penalties, higher taxes on the wealthy, plus over 2,700 pages of details yet to be determined. There are several important areas not addressed by this legislation, including universal coverage. 23 million people remain uncovered. Most of these individuals are undocumented immigrants. Also, in my opinion, meaningful cost control, tort reform, and a clear understanding of the long-term effects of the legislation. And finally, a permanent fix to the physician compensation formula. The ACA is far-reaching and complex, and paying for health care reform remains a daunting task. Under the new law, financing will come primarily from a $500 billion cut in growth of Medicare spending, tax increases on the wealthy, and substantial new taxes on drug companies and medical equipment suppliers. These resources will support Medicaid funding on a national level, but many states will struggle to pay their portion of this program. State funding issues are especially relevant to emergency medicine. Recent articles in the Journal of the American Medical Association and from the CDC report huge increases in ED volumes to 124 million patients in 2008. Most of this growth is attributed to more visits from Medicaid patients. These types of challenges leave us with no permanent resolution to the physician compensation formula, known as the SRG, which was implemented in 1998. On January 1st of 2010, all physicians were scheduled to receive a 21% cut in Medicare reimbursement. Fortunately, as they have for the past few years, these cuts have been put on hold. The pending cuts represent an estimated $370 billion in costs that were not included in the $1 trillion cost estimate for healthcare reform. This will continue to compound if the physician compensation issue is not resolved, and will reach an estimated $500 billion by 2015. There's a lot we do not know and understand about the future implication of this new law, but there are things we know that will affect all of us at ECI and HCI. In coming years, there will be an increased focus in several important areas: higher quality, improved efficiency, increased accountability and verification, and better risk management. Since 1972, our organization has remained committed to achieving all of these ideals. As a result, we have created a wealth of highly innovative programs that continue to benefit practitioners across the country. I believe that no other organization in emergency medicine has the level of talent, expertise, and commitment that ECI has in the many new challenges of healthcare reform. A new day is dawning in American healthcare. All of us at ECI and HCI are awake, energized, and ready to go. Thank you.